Good morning. My name is Amy Lemley, and you are on today's web seminar, which is What Did We Miss? A Policy Agenda to Improve Foster Care for Young Adults. Thank you all for being here. We're really excited to share the information that we have today, and we are very grateful for our co-organizers in today's web seminar, which is the Children's Law Center of California, the National Center for Youth Law, the Children's Advocacy Institute, First Place for Youth, and then our special guest today from Butte College, Karen Michelizio. So before we jump into the content, let's take a minute to make sure everyone knows how to participate. This screen shows the call-in number and access code. We are recording today's web seminar, and it will be posted at thpplus.org along with the slides for today. And we hope as we move our way through today's presentation, you will submit questions as you have them. And to do that, it's very easy. Just type them into the question panel on the control panels portion of the web seminar interface and press send, and we will get to as many as we are able to get to today. So the genesis of this web seminar was really the 4th anniversary of the implementation of extended foster care. It was an amazing accomplishment for California, and many on this call were integral to its passage, from caregivers to young people, county representatives, our elected officials certainly, advocates, all working together, based on the evidence provided by Mark Courtney and his colleagues, to offer a better future to young adults in California by extending foster care to age 21. A tremendous amount of effort went into the development of that policy, and we have since had not only the child, also the grandchildren and the great-grandchildren in terms of subsequent legislation to improve and strengthen the policy of extended foster care. That being said, when that policy passed, we didn't have a crystal ball. We didn't really know what it was going to mean to serve young adults in foster care, because that is what non-minor dependents are, young adults. We thought a lot about the kind of legal process and the service process, but nonetheless, really 4 years into this experiment, California's had the opportunity to think more deeply about the lives of 18 to 21-year-olds. What is going on in the life of an 18 to 21-year-old in a way that we didn't before? And so today's web seminar is about highlighting 3 areas that collectively our organizations have identified as areas that perhaps did not receive the attention that they could have or that they should have when we extended foster care to age 21, through no one's intention. But nonetheless, we're 4 years down the road. We've learned a lot. A lot of young people have been served. We've heard from them. We've heard from providers. We've heard from counties. And these are 3 that are emerging as ones that we believe it's time to address. Now, is this list exhaustive? No. But we feel like it's a good first start in terms of trying to ensure that California's policy is one that ensures young people transitioning from the foster care system into young adulthood have the best opportunity possible. So the first one we're going to talk about is higher education. How does our foster care system help foster youth reach and succeed college? As many of you know, in the past, the primary focus was high school completion. In fact, we even had the high school completion rule, where a young person could be in care until 18 unless they could show they would graduate from high school by their 19th birthday. So the completion of high school was a very big marker in our former system. Now with care until 21, we need a new marker, a marker that includes college and career and technical education. How are we doing that? How are we shifting our system culturally to reorient from high school to college and career and technical education? A second one is pregnancy prevention and reproductive health. Now, young adults and adolescents in foster care had sexual lives and were sexually active before the extension of foster care. However, what we really didn't appreciate, largely because we didn't have the data, is the numbers of young people who were becoming young parents in that 18 to 21-year-old time frame. How does our foster care system work with our adolescents and our young adults around their sexual health and their decision-making around family formation? This was something that, 20 years ago, it would have sounded crazy to even pose that question. But with extended foster care and this large population of adolescents and young adults in care, this question has come to the forefront. And the third question that's very closely related to that question is young families. We now have a not insignificant number of young families that are being served by our foster care system. We've always had teen parents in foster care, as many of you participating know this. And as I've shared before, my very first job in foster care was in a group home for pregnant and parenting teens. So that's nothing new. But with the number we have now, we are asking ourselves, how is our service to these highly vulnerable young people different? What does it mean to be a young family in foster care? What do we need to do differently? So these are some questions that, as we've expanded our service to young adults in foster care, have really come to the forefront. And they've come to the forefront for the reason in this next slide is because we have thousands of young adults in foster care in California. When the extended foster care policy was being developed, we hoped for an uptake rate as high as Illinois or New York. Little did we know we would have one that is really upwards of 90%. I think it's for two reasons. One is a variety of ways that make it easy to participate and newer youth-friendly placement options. Equally important, and maybe a little less optimistic, however, is the challenge for these young people to integrate into the job market and the housing market. And so this is an option that seems worthwhile for them. So with over 8,000, almost 9,000 non-minor dependents, we feel it's a good time to revisit this policy of extended foster care and really keep shining it, keep challenging ourselves to say, we made a good start, but what are our blind spots? And so that's the purpose of our conversation today, is to highlight a few of what we believe may be blind spots that we can address through policy changes in California. So to talk about higher education, we're going to hear from Melanie Delgado of the Children's Advocacy Institute, Jackie Wong of the National Center for Youth Law, and Karen Michelizio from Butte College to give us a perspective on campuses. Then we'll turn to my colleague, Debbie Rauscher of the John Burton Foundation. Following that, we will focus on pregnancy prevention and reproductive health. I will talk a little bit about that. And then to discuss young families in foster care, both myself and Jessica Rodriguez from First Place for Youth will be discussing that. And we're very excited to have Jessica, who will share their perspective as one of the providers serving the largest number of parenting dependents and former foster youth in the state. So with that, let me turn it over to my colleague, Debbie, who's going to share a little information about education and where we are in terms of our young adults in foster care.
Thank you very much. So if you can move to the next slide. So one of the first things that I want to talk about here is that we know foster youth want to go to college. So it's not the case that foster youth are resistant to college, or they're not interested in college. There's been a number of studies done. The one that you see on the slide is from the Cal Youth study, where 80% of the youth surveyed reported wanting to earn a college degree or higher. 73% said that they expected that they would earn a college degree or higher. There's been other surveys. Back a few years ago when AB 12 was being implemented, there was a survey that was done that provided very similar results. So we know that foster youth have these college aspirations. Next slide. Unfortunately, the reality doesn't match these aspirations. So while 73% of foster youth believe themselves to earn a college degree or higher, when you look at the statistics, unfortunately, it doesn't bear out that those dreams are turning into reality. 56% of foster youth enroll in college within 12 months of high school, relative to 64% of the same age non-foster youth population. So there's a big disparity there. This is important because enrolling within 1 year of high school graduation opens one up to access to certain financial aid sources like the Cal Grant that would not otherwise be available. There's certain benefits that foster youth age out of, and so if they delay starting college, then they don't have the same resources available to them as they do if they are able to start at a younger time. Only 46% attend full-time. 34% attend full-time versus 46% of the non-foster youth population. There's a lot of research that shows that full-time attendance is correlated with successful degree completion, so this is a concern. The next point there, this is a really big concern. When you look at the percentage that earn a 2.0 or higher, only 49% of foster youth earn a 2.0 or higher as compared to 71% of the non-foster youth population. So you can see huge, huge disparity. And we see this in a lot of other indicators as well. If you look at course success rates, you see a 15-point difference between foster youth and non-foster youth. And even we've looked at the difference between foster youth and some other at-risk groups like first-generation students. And what we see is that foster youth don't fare as well even than other groups that are considered to be disadvantaged students. And then you see the AA degree completion by age 26 from the Midwest study. The most shocking, I think, of the statistics, 46% of the same age non-foster youth have an AA as compared to only 8.2% of foster youth. So that 73% who believe themselves to be able to earn a degree is shrinking down to a reality of 8.2%. Next slide. So college affordability is a key factor in this success or lack of success. There's quite a lot of research that shows that having access to financial aid is a key indicator of whether a student, in particular a low-income student, is going to be successful in college. And you can see on the slide there, this is the official 9-month budget that are used at a couple of sample institutions, one a community college and one a Cal State University. We know, of course, that the actual cost of room and board in many areas is higher than the official numbers. Financial aid offices have the prerogative to adjust the cost of attendance for special circumstances. And so there's many cases where the actual cost of attendance is going to be higher than what we're showing here. For foster youth, they're in a very precarious situation when they're participating in school. And one hiccup, one challenge that presents itself financially can mean the difference between being successful and being able to stay in school versus not stay in school. So one car repair when the car is the only way you have to get to college. A health issue that comes up that costs you, you crack a tooth and you have to get it dealt with. You get a rent increase that you weren't expecting. Anything like that. And whereas most students have a fallback, they have a family that maybe they can go stay with or who can give them some emergency money to help see them through or loan them a car or whatever that they need. Foster youth are much less likely to have that kind of backup resource available to them. And so what we see on the campuses is that something like that happens and they drop out of school. They can't afford to buy their books, they can't afford to pay their tuition, they need to increase their work hours, and so they can't keep up with school. There's all kinds of reasons why having access to the financial resources necessary is so important in getting those success numbers up. With that, I'm going to turn it over, so if we can go to the next slide. I believe it's Jackie who's up next.
Thank you, Debbie. Now I'm actually going to go through kind of the history of the Chafee Education and Training Voucher Program, which was established in 2002 through the John H. Chafee Foster Care Independence Program at the federal level. It actually runs in California as a pretty much a financial aid program. It's a program primarily of the Department of Social Services, and is through an MOU with the California Student Aid Commission, is administered that way. It is also kind of, it's a federally funded at 50% with a 50% state general fund match. And the funding actually has remained flat since 2002. Next slide, please. So to be eligible for the Chafee Education Training Voucher Program, you have to have been in foster care on or after the age of 16 and are under the age of 24. Although the maximum grant that one can receive is $5,000, what we know from the data is that the average award amounts are about $3,200. And these monies can actually be used for college or vocational education. And it's actually not prorated based on your level of enrollment, and is the only dedicated source of financial aid for foster children or foster youth. Next slide, please. We also know about receiving the Chafee program, which I have found extremely interesting and not really a shock to most people, is that young people, students who actually receive this Chafee grant, have higher GPAs and a higher pass rate. But more importantly, they stay in school. As you can see by the data, is that approximately 50% actually persist to that next level, while 34% who do not receive the Chafee grant actually persist. That's actually a 48% increase in persistence. Next slide, please. We also know that the CSAC has also made extreme improvements to the Chafee program, and for those of you who have been around for a bit, we used to hear a lot of stories of checks taking about 6 months into the school year before ever reaching the students. And so through kind of discussions with advocates, and thank you to John Burton Foundation and others, is that CSAC has been extremely responsive to the needs of students in foster care or former students in foster care by first automating the grant distribution. So there are no more paper checks. They've actually eliminated that, which was kind of a huge bureaucratic burden where checks would remain in offices for weeks and months at a time before actually reaching a student. They've also realized that the needs assessment report that was part of the Chafee was unnecessary, and have eliminated that, primarily because if a student fills out the FAFSA, all that data already exists within the financial aid system. So there's been a lot of strides in kind of how to distribute these monies more effectively to our students. Next slide, please. While this is extremely affected, the funding is still extremely limited and prevents essentially the students who are eligible from receiving it. What you can see and what we know is that approximately 25% of the young people who apply for the Chafee grant actually receive it. For example, based on the data, is that even though 4,609 students were eligible for the grant, only approximately 3,500 were able to receive it. And only we have 1,000 students on college campuses now who are unable to access these funds. Next slide, please. And because of note, as more and more non-minor dependents come into the system, we imagine that the Chafee grants will be more utilized over time. Next slide, please. I'm going to turn it over to Karen to provide us with a perspective about how this works on campus.
Good morning. As many of you that work with foster youth know, the financial aid process can be very confusing for youth. And so giving them the guarantee that the monies would be available if Chafee were to be an entitlement program just goes a long way. We could really start those conversations with students at younger ages and guarantee them that this funding will be available to them. And it's hard because they hear that college costs a lot of money. They hear that they're going to be out on their own. They've got all this anxiety around how is that really going to look, even though they have support people in their lives. It's difficult for them to envision how that will look when they're on their own. They're, those sorts of things. Even with AB extended foster care, it's still a scary time for them. They're losing that support group at the high school level, and it's a big change. So if we could start working with them at a younger age and guarantee them the Chafee will be there. This is $5,000. Here's a federal Pell Grant that you will be eligible for in, around $5,700, and really sit down with them and map that out and what it looks like. It would just be such a relief for them, and I think that they would start dreaming about college. They would start seeing themselves there at a lot younger age. If we can, we all cheer them on and tell them that that's what happens next and try to get them to that point, but to be able to say, here's the funding behind it. You will be okay. You will be secure. You'll be able to pay your rent. You'll be able to, those sorts of things. And at the college level, we have students that come to us from out of our county. So even though we have very good working relationships with the counties that we serve as a district, we're dealing with social workers, ILP workers, county, personnel from multiple counties. And as you know, every county does things differently. So it's really difficult for us to guarantee a youth something that's tied to their county and how their county makes decisions and how their county allocates funds. And so just a couple instances is we've had 600 level youth that come to us from maybe boarding schools or those types of high school settings, and it takes a long time for those. It can take a number of weeks, a number of months for those youth to actually get their AB-12 funds in place. I've had that happen, where their ILP worker, social worker gets them set up here and then leaves, and they have no funding because school hasn't started. We aren't dispersing financial aid yet. So those, unfortunately, all 4 of those youth did not make it, and it was very heartbreaking. But having for us to have a little more authority over oversight of funding that is coming to them while they're waiting for those other resources to come through, again, would be just a huge support for the youth. Another situation we have right now is that a youth is eligible for the Chafee grant but is not eligible for AB-12. So if she didn't have that Chafee grant, she would really be in a bad situation right now. So it's such a huge amount of funding for them to have, and again, just a support and a guarantee that it's going to be okay. This is really, you really can do this. You have the resources, and again, to be able to show them, here they are, and let's work from here. Let's get you a budget going. Let's talk about what this looks like when you start putting it to your living expenses. And so again, being able to have that conversation with youth younger, that we know for sure there will be funding here for you, would just be a huge relief for them. And again, getting them looking to college, not just listening to us give them lip service, but here's how we see that going into play. It's just a huge support for our youth. So thank you.
Thank you, Karen. While we have you, can I just ask you to comment on Debbie's remark around the precariousness? I've had that experience with young people, like one little road bump. Is that something you see in your practice at Butte, where what would seem to a student who's not a foster youth quite easily surmountable really sidetrack their progress in college?
Absolutely. We've had youth even say that, the parking lot was too full, or I didn't know where this classroom was, and I got overwhelmed, and I felt like I was the only person that didn't know. They don't always have people in their lives that they haven't been hearing about the college culture, and so they don't know that everyone, there's a lot of students here that are feeling the same way they are necessarily. Once we can get them connected to our foster youth programs on our campuses, it's helpful. At least they have a safe place to go to and to people to ask, and then other students who are feeling the same way as they are as far as being lost. So making those connections are important. But it's very easy for them to get overwhelmed. And the same thing with our parenting youth. We seem to have a high number of parenting youth here this year, and if they don't have that secure child care or those other resources, and it's just, we all know, and those of us that are parents, it's a lot more time-consuming, a lot more work to be able to move forward with your own personal development when you have children that you're concerned about.
Thank you. There's many more questions for you. We will wait till the end of the presentation to take those. But thank you for sharing that experience and for your service to young people every day at Butte. We really appreciate it.
Thank you.
We'll turn over now to Melanie Delgado with the Children's Advocacy Institute to talk about Assembly Bill 2506 that is working to improve access to Chafee. Thank you, Melanie, for being here.
Thank you. AB 2506 would address some of those road bumps that Amy was just discussing and some of the issues that Jackie and Karen talked about by entitling all students who apply by a specific date to receive Chafee grants. That date would likely correspond with the deadline for competitive Cal Grant applications, which is September 2nd. And the date is to ensure that it's easy for students to remember and apply by the date, and it ensures that the funding is there available. What does entitle mean? Entitle means that any eligible student that applies by the specific date that is set would receive Chafee funding. Like Jackie was saying before, Chafee funding right now is very limited. There's a the federal government gives California a set amount of money. California matches that, and when that money runs out, then there are no more Chafee grants available, and that provides a roadblock for a lot of youth, as you heard. This would ensure that those youth would get that Chafee funding that is so important. Applicants who apply after the date would be eligible for remaining funds. Next slide, please. Can I get the next slide? AB 2506 would require campuses where 40% or more of the students receive financial aid to meet minimum requirements. And those requirements would be that the campus cannot have over a 15.5% cohort loan default rate, and I'll talk about that in a minute. And the campus must have at least a 30% graduation rate. And the reason for these minimum requirements is that these are two things that are big red flags. If a campus has a default rate of over 15.5%, and that means if more than 15.5% of the students that have gone to this school are falling so far behind on their loans that they can't pay them back and they default on those loans, then that is a big red flag that either the college is not offering these students an education that is allowing them to secure a job so that they can pay back their loans, or it's not properly preparing them so that they can secure a job that will pay them enough to pay back their loans. And so it's a big red flag that that's not a good program. And the second one is the 30% graduation rate. If a campus does not have at least a 30% graduation rate, that may be an indicator that the preparation and education and supports at that campus are not such that the students can succeed at that campus, and it's a big red flag that that's not a program that's going to help students. These two requirements would not, the minimum requirements that I just talked about would not apply to campuses where fewer than 40% of the students are receiving financial aid, and those are campuses like, for example, community colleges. Not very many students at community colleges will be receiving financial aid, and so often the community colleges would be exempted from this. And this policy has been in place with the Cal Grant program since 2013, and it has proven to be pretty successful in encouraging campuses that are not performing well to increase the quality of their education. The number of ineligible campuses for the Cal Grant program has dropped from nearly 140 to about 90. And so several campuses have raised their standards as a result of this.
Thank you, Melanie. So that is really the first policy proposal that this group is advancing this legislative session, AB 2506. We appreciate Assemblymember Thurman's leadership, his willingness to step out and support foster youth in this way. And later in the conversation, we'll talk a little bit more about what you can do if you want to get involved with that. I'm going to turn it back now to talk to Debbie to talk about a second approach and a second issue under our higher education topic.
Great, thank you so much. So I am going to talk about priority registration. If we can go to the next slide. So priority registration, people may be aware that back in 2011, through the passage of Assembly Bill 194, foster youth were given access to priority registration. So what this means is that foster youth can register for their courses before the general student population. This is a tremendous, tremendous benefit for foster youth. People probably are aware that a lot of the most popular classes, the classes that are required for graduation at community colleges as well as CSUs and UCs, are impacted. It can be challenging to get in. There's waiting lists for a lot of classes. And what priority registration allows foster youth to do is access the courses that they need each term. And the reason why this benefit is so important is there's a few reasons. If foster youth don't get the courses that they need, it delays the time for them to be able to finish their degree. Oftentimes they end up taking classes that don't necessarily count towards their graduation, or they have to just continue to take classes while they're in school to maintain their student status while they're waiting for the class that they need to be able to graduate. And so it delays the time. What then ends up happening is that the foster youth are using up their financial aid. And with the Pell Grant in particular, the Pell Grant is only available for 6 years. And so for somebody at a community college, if they have to spend a lot of time in community college because they can't get the courses that they need to graduate, by the time they get to a 4-year institution, they may have used up their access to the Pell Grant. And that's a huge problem, obviously, to be able to be successful to go on to get their bachelor's degree. So it delays the time for degree completion. It reduces the access to financial aid. One of the other things that priority registration does for foster youth is it enables them to really select the courses that are appropriate for them and the professors that are appropriate for them. And so sometimes they may have a particular learning style, or they may have learning disabilities, and so it's really important that they're able to participate in classes with professors who understand how to work with somebody with learning disabilities, and so they can do some research on that and make sure that they get the courses that are going to be most likely to support their capacity to be successful. And we know that they're using it. You can see on the slide, close to 8,000 foster youth use priority registration in the 14-15 academic year. Next slide. So when AB 194 passed, it included a sunset clause. So as of January 1st, 2017, priority registration for foster youth goes away. It's gone. The same is actually true for students who are in the EOPS program, which is the Community Colleges Program for Educationally Disadvantaged Students, and DSPS, which is the program for students at a community college who are disabled, so it's the Disabled Student Program. And those two groups also have priority registration access, and all three of those populations lose their priority registration as of January 1st, 2017. So what Senate Bill 906 will do is remove the sunset clause. So it allows priority registration for all three of these groups to continue beyond the sunset date of January 1st, 2017. It also makes a couple of small changes to the eligibility criteria for priority registration for foster youth. Right now, the eligibility for priority registration if you're a foster youth is that you have to have been in foster care on or after your 18th birthday, and it goes up to age 24. And that definition doesn't align with any of the other services and programs that exist. So there's the new Chafee's program and the Chafee Grant program and Medi-Cal eligibility. So the new eligibility would be that somebody would qualify for priority registration if they're in foster care on or after their 16th birthday, and it would go up to age 26. So this puts it in sync with the Chafee's program. The 16-year-old being in foster care after the age of 16 puts it in sync with the Chafee Grant program. It puts it in sync with the ILP program. So it just will make things logistically a lot easier for people to track what benefits that they're eligible for. So that is the gist of what Senate Bill 906 will do.
Thank you, Debbie.
Back over to Amy.
Great. So we have a lot of questions about both of those provisions and just about the topic of improving academic outcomes for post-secondary education outcomes for foster youth. But we hope that these two bills are the beginning of a long line of policy changes so that when we have the next webinar in 4 years, maybe we're talking about graduate school. You know, that sounds crazy maybe to some of you, but that we have shifted our expectations, that we expect young people to either enroll in college or go to career and technical education. Because without those basic skills, as we all know, we simply don't have an economy where they will not be in poverty, which is not the goal of foster care, far from it, and certainly not the goal of extended foster care. So we're going to turn back to your questions at the end of the presentation, but now turn our attention to the second topic where we, feel like there was an area that was overlooked when foster care was extended to 21, and that's really around the reproductive health and pregnancy prevention needs of young people in foster care. And so much of what we know now, we didn't know then. So, I want us to be gentle with ourselves, thanks to amazing researchers. We have a better understanding of what our young people in foster care are experiencing. And, when foster care was extended in age long ago, we didn't know the high rate of pregnancy among young people in foster care. So if you haven't done it already, I do hope you'll sit down and give a thorough reading to the baseline survey from the Cal Youth Study. And it was a study, it's going to be following young people in extended foster care to understand the positive or negative impact of the program. But what the first survey was a baseline survey of 17-year-olds in California to understand what's their experience so that it could be measured against that experience. But for many, the real shocker was the extremely high rate of pregnancy among California foster youth. So you can see on the screen at age 17, over 1 in 4 girls had already been pregnant. Most of them only once, a couple of them twice, and even fewer 3 or 4 times. But this is a rate, we don't have the exact age 17 to age 17, and we always want to make sure to compare apples to apples. So, kind of admittedly, this is not apples to apples, but in California of 15 to 19-year-olds, we're looking at a rate that is much smaller than that, around 2.1%. So this has very serious implications in terms of those young people, their health and well-being, and the health and well-being of their children. And I think, again, we, as a system that has historically focused more on younger children, we have to ask ourselves, what are we doing as the entity that has the legal responsibility for adolescents and young adults to educate young people about their reproductive health and to help them be thoughtful about their family planning. So the good news is we have some pioneers in California, and here's a map of who those pioneers are. There are perhaps many others, but these counties you see on the screen have been piloting solutions for the last 12 to 18 months through a participation in a project, and they're really looking exhaustively at the experience of their adolescents and young adults in care, what they can do to begin to have these conversations to prevent unplanned pregnancy so that young people can have the opportunity, if they want, to delay family formation and to enter into post-secondary education and career. And so there are a lot of kind of things being tested on the ground and others that aren't being tested but that we know exist. And they kind of fall into 3 different categories. The first one is training for caregivers and social workers. And so this is, really training to equip caregivers and social workers about how to have medically accurate, age-appropriate, culturally competent, trauma-informed conversations with young people in foster care about their sexuality, about reproductive health, about family planning, about good decision-making, so that they have a level of comfort and skill, so that when a young person is ready to have that conversation and interested, they can have it. So that's one whole set of trainings that are happening in Los Angeles. They're really leading the way with a training series called Sexual Health Conversations. They have a lot of people to train, but they've got a really great start on it. It's a half-day training for all of their child welfare workers and a number of other personnel categories so that they can be prepared to really speak to young people and ensure that they have access to reproductive health and just the support around this topic. The second category is really training for young people. And all of the examples you have here are evidence-based, not just the little asterisk should be on all of them. These are ones that have been tested where there hasn't been a longitudinal study. They have compared a treatment group with a non-treatment group. The first curriculum at the very top of that category, called Making Proud Choices, that's the only evidence-based curriculum for youth in out-of-home care. And so that there's a lot more to say about making proud choices, but these are examples of interventions we can bring to young people that they can experience and that we have evidence will reduce the rate of pregnancy and reduce the rate of sexually transmitted infection. So we're not guessing whether they work. We know they work because they've been tested. And then the third area of activity that's really gone on around the strait is the development of policies and procedures. And so what do I really mean by that? What I mean is it's really understanding at a county level what the role of a social worker and others are in ensuring that all youth age 12 and over have access to reproductive health services, including pregnancy prevention. And this is something we really learned in our California Foster Youth Pregnancy Prevention Institute. The responsibilities can be very diffuse. No one really knows whose job it is to broach these topics with foster youth. Whose job is it to take them to Planned Parenthood? Who's allowed to do what? How is sensitive information kept confidential? And so the development of these local policies and procedures is extremely important. So, we believe that, that these kind of activities are mission critical at the county level. And the counties that you saw on the previous slide are out of the gate and they're doing it. No public support, no new public support. And so the second, part of our agenda to improve foster care for young adults is really to put that public support in place, is to have a budget proposal for this year's budget that's passed, so it'd be 2016-17, that would support these efforts locally, that would say, we know young people are getting pregnant at rates far above the general population, and we know that has serious long-term implications for them and their children. So we want to incentivize counties to implement strategies to reduce unwanted pregnancy in foster youth. It can be training for social workers, training for youth, ensuring youth have access to reproductive health services, ensuring that we're following the letter of the law. I think sometimes when a law gets passed, we assume that everyone knows how to implement it. But that only happens if detailed procedures are made at the local level. And those counties that you saw from the map, they've done that. They're making sure that they know what the rights of our minors and non-minor dependents are in this area and that they're respecting them. So they're our pioneers. We have a lot to learn from them, but they are only 6 of 58 counties. We need every youth in any county to be able to access these services if we're really going to impact this problem at a greater level. So this budget proposal, would be up to $10 million to support these activities locally. And so that's what we have asked Assemblymember Tony Thurmond, who is the chair of the Budget Subcommittee number 1, which is the Health and Human Services. And we're hoping that or some fraction of that can be used to support these activities locally so that, during wave 2 or wave 5 or future research that's done, we can look at our 17-year-olds and we can bring that number down from over 1 in 4 to something approximating the general population. We can't expect it to be as low as the general population because of the trauma, abuse, maltreatment that our young people have experienced and their vulnerability for these kinds of outcomes. But I think that we can all agree that 26% is a rate that we shouldn't find acceptable. So very closely related to that, and I'm going to change topics, is the third area. So we know there's a high rate of pregnancy, and where there's smoke, there's fire. Where there's pregnancy, there's children. And so we've really seen a lot of young families in our extended foster care program. Again, we didn't have this research before. Now we do. We know that since AB 12, many non-minor dependents give birth by age 21. We didn't really think about this that much before extended foster care because foster care wasn't responsible for them. It now is, and so thanks to Emily Putnam-Hornstein and her team at the University of Southern California, we have a very good statewide snapshot, and she has the rates by county, which are very interesting. So we know of young people who are in care at 18, and that's those young people who will participate in extended foster care. Over a third will give birth before age 21. And so what we have is a lot of young people who are custodial parents. And according to our latest estimate, it's at least around 850 non-minor dependents or non-minor dependents who have custody of at least one child. So what is that like? What is that like for these young people? And unfortunately, we as a foster care system are largely raising these children in poverty. And that's because the rate that is paid for the non-minor dependent combined with the infant supplement, which is a small supplementary payment, is not above the poverty line. Now, no one designed it that way. No one is trying intentionally to keep young parents in poverty in foster care, but mathematically that's the reality. And so we are very concerned about this because of the very deep effect of raising children in poverty. This is one of those areas kind of like climate change where the science is definitive. We know that the effect of poverty on children, and it's not just on their parents' employment, it's actually on the children themselves. So I'm not going to go into a lot of detail about this slide, but this comes from a landmark study, really the first one that ever put the link between poverty of children, of the parents, and the effect on children. But you can see, the strongest effects are on the poor physical health, child maltreatment, and early childbearing among the children themselves. But there are also effects of cognitive delays, emotional and behavioral problems, and low school achievement. And so no one thinks it's good for children to be raised in poverty, and yet that is virtually what our current policy is doing. So I want to turn it over to Jessica Rodriguez. They have the benefit of the experience of serving a lot of young people in care and really can tell us about what it is like from a cost perspective for a young person to be in foster care and what that reality looks like relative to someone who's not a parent. So thank you, Jessica, for being with us.
Sure, thank you, Amy. So at First Place for Youth, for those of you who don't know, we do stable housing and education employment services for transition-age foster youth. Currently, we're serving, of the 309 youth we have housed, 99 are parenting foster youth. So that's about 1/3, which matches what Amy just said about the high number of foster youth who become parents, especially during this transition age. So some of the costs, becoming a parent is challenging and expensive for anyone. It becomes even more complicated for young parents, and that the challenges multiply when it's a young parent who's also a non-minor dependent and who often lacks essential supports and resources needed to be a parent. So this slide kind of details some of the costs that we see our parenting youth having to incur as they have children. So some of the one-time costs you can see here: crib, car seat, CPR first aid, training, baby proofing, stroller, high chair. And then there's the ongoing costs of diapers, baby wipes, clothes, toys, bottles, food, childcare, and then the incremental rent cost, which is the extra costs that parenting youth have to be able to live on their own versus non-parenting youth who can have roommates, for example. So as you can see, when you add these costs together, parenting foster youth have to pay a lot of money. And this can be very challenging for anyone. It's even more challenging for this population who have trouble maintaining employment and striving toward education goals. So we want our parenting youth to be able to engage in our programming as much as our non-parenting youth, and we want them, of course, equally to be able to succeed. And for parenting youth, not only for themselves, but now for their children. We recently, at First Place, released a study called More Than Me, which is available on our website, studying the differences in outcomes for our parenting versus non-parenting youth. Some of the most stark findings were that we're in the education and employment areas. So for education, parenting youth were found to be far less likely than non-parenting youth to attend post-secondary education. And then when we come to look at employment, parenting youth in our programming are less likely to be employed, and their average monthly earnings are less than our non-parenting youth. So some of the specific statistics for employment at entry to our program, 19% of parenting youth are employed versus 36% of non-parenting youth. And so then when we work with them in program, we do make big strides. 42% of parents at exit are employed, but still 64% of non-parents are employed. So there is still a disparity between our parenting and non-parenting youth, although we do make strides with them during our programming. And for these reasons, I think it demonstrates the acute needs our parenting youth, non-minor to parent parenting youth have when we're thinking about the financial stress that they have to incur when having a child, and especially as they're going through this transition age in their life where the decisions they make, the employment and education choices, and the supports they receive will largely determine what happens in their future. And so being able to support them in better ways is not only important for their success, but also when we're thinking about, like Amy said, ending intergenerational cycles of poverty. Thank you, Amy.
Thank you, Jessica. We have a lot to learn from our young people and providers like First Place that are serving a lot of young people, and I know there are many on the web seminar who are also serving young people who are parents. So what do we want to do about this? We know it costs a lot to be a young parent, even in foster care, and we know that raising children in poverty is not a good thing. So what the proposal is, it should be AB 1838, that's my error, would move families in foster care above the poverty line. It would change the infant supplement from its current set rate of $411 to make it equivalent to the basic rate for that child. So you can see here we have the basic rate would go from $411 to $686. And we're moving from below the poverty line to above the poverty line. And in case anyone's thinking, well, that's not that big of a deal, right? I mean, they're still very low income. The studies show it does make a difference. Sometimes, what would seem marginal can make a significant difference. And we know being below that federal poverty line is very problematic. So the infant supplement has been around for a long time. It's been around really since 1989. It was first established in federal law, and then it was adopted into state law. It is 50% reimbursable by the federal government for federally eligible children. It was originally set at $326, and it's currently $411. So, it's been a long time. You can tell right there that it has not kept pace with inflation. There is a separate rate for group homes that was originally set at $708, and it's now $890. So it's been raised periodically. It hasn't kept pace with inflation, and it really just doesn't come close to meeting this list of expenses that young people who are parents in foster care experience. And what that means practically is if you want let's say a relative or a foster parent to keep a parenting dependent. Let's say I'm a foster mother to a 17-year-old and she becomes pregnant. We are shifting those costs onto that foster parent or to that relative. And they're going to do one of two things. Either they're going to buckle down and they're going to kind of, take from themselves or their family to serve this parenting dependent, or they're going to say, I just can't afford it. and that young person is going to have to shift placements. So neither one of those outcomes is something that we want. So, the number one goal, let's prevent the pregnancies if the young person does not want to become pregnant. But if they do, let's support them and ensure that they are not in a situation where they're going to have to move. So AB 1838 is wonderfully authored by Assemblymember Phil Ting from San Francisco. And it would do a few different things. It would increase the infant supplement from the current level to the basic rate. And it's the basic rate of the child, of the non-detained minor. So you can see there are the two increments that would be most likely. If a dependent has a child from birth to age 4, the infant supplement would be $8.68. If, let's say, they became a young parent at age, 15, which is very, very rare, but let's say they did, then the basic rate by the time they were age 20 would be $744. That first rate, however, would be by far the more common one, given that most young people are too young to have a child, age 5 to 8. It would also allow the infant supplement to be received 6 months prior to the due date. We can't go into a long conversation about that, but what we really learned from our work with the 6 counties, specifically Los Angeles, is that young people disclose their pregnancies late. That they and the hope is by allowing the infant supplement to be paid 6 months prior to the birth, we could incentivize young people to tell us that they're pregnant so that they can be referred to nurse-family partnership, they can be referred to prenatal care, which is essential, and other programs, existing programs, that can support their pregnancy and support them as young families. And then lastly, it would develop a new infant supplement for group homes and for THP plus foster care. Group homes do currently get the higher rate. For some unknown reason, THP plus foster care does not. It gets the lower rate. But if we're going to change the infant supplement and tie it to the basic rate, we need to step back and say, what do we give our group homes and THP plus foster care, and what expectations come with that money? What are we really expecting of these providers? And then create regulations, and then give them the resources, and then also hold them accountable for doing that. So a lot of information we're going through today, and I really appreciate everyone's patience. What you have here is what we have now before us, the legislative and budget process. So we've really talked about 4 activities, or four specific proposals in the current legislative and budget session that we believe will make important changes to foster care for young adults. First, we talked about the Chafee Education and Training Voucher. Then Debbie talked about priority registration, maintaining this essential tool, modifying its eligibility. We turned our attention to a budget proposal for pregnancy prevention, and then we closed with the infant supplement, increasing it and making it available earlier. But the truth is, none of this happens without your help. That this has to be, while those of us on this web seminar care about foster youth and we think about foster youth, and most of us have dedicated our professional lives to foster youth, we are not necessarily the most influential group in the policy and budget making process. And so these kind of proposals are only going to move forward if we band together and send the message that while extended foster care was great, we cannot stop short of getting the full job done. And so we do need your help, and that is part of the purpose of this web seminar, to raise these issues, to propose these solutions, but to ask for your help. And here is just a quick slide before we spend the last few minutes on questions and answers about how we hope you can help. The first thing is something you do from the comfort of your computer, which is simply to send a support letter. I remember before I got involved in this field, I'm like, that doesn't matter. It's just a piece of paper. But it does matter. Many bills don't have a single support letter. When we can get support from a geographically diverse group of people from around the state and organizations from around the state, and it can be included in the committee analysis, it makes a big difference. So the kind of easiest lift is to send a support letter, and we've even drafted sample support letters so that you don't have to go to the effort of crafting every last word, because if you're like me, you're pretty busy, and it's always nice to have a little start to the letter. SB 906, the deadline for those support letters is actually today, because it's going to be heard in the Senate Education Committee next Wednesday. So if you, so that's the kind of one way to help. A second way to help, if you are feeling like, man, I want to get involved in this. This matters to me. I've got a story to tell. I've got a reality I want to share, is to give public testimony. All of these provisions will be heard in different committees, and there's nothing more powerful than sharing your reality as a practitioner, as a public administrator, as a young person, as an FFA director. Regardless of your station, you have a reality that can enrich the conversation, and so we'd love it if you could come and give testimony. And the other is just to simply let your senator or your assembly member know that you want this to happen. Again, it's kind of a million different things that happen all over the place that make something possible. We'll never really know why extended foster care was possible, but I have a suspicion that it was because of this massive, broad support from every corner of the state. We came together and in a million different small ways sent that message. So that's what we're trying to do here. These policies aren't nearly as monumental as extended foster care, but we feel they're really strong complements to the existing policy. So with that, I want to turn it over and try and address the many different questions that we've gotten. It's 11:03. We said the web seminar will go to 11:15, and we'll get through as many questions as we can during that time. So one question, and this is for you, Karen, is do foster youth high school education, in your opinion, adequately prepare them for college curriculum, and do they underutilize resources at the community college level?
Okay, there's a couple questions in there. As far as high school preparing them, that's going to be student by student. I mean, I think it's really difficult to just say a blanket statement on that. I do feel that there's a lot more work to be done to make sure that these youth are supported in the high schools, and that the high school reaches out to them to make sure they make financial aid deadlines, they're registering for the SATs, and they know that there's a fee waiver for them, because they hear about there being a fee for the SAT or the ACTs, and so they don't even ask about that. And making sure that they're participating in any of the early registration activities that are happening at their high schools by their local colleges. I think you need case managers there. You need to make sure that they are reaching out to those students. Don't count on those students to come to them for those kinds of resources. I believe every county is going to be different as far as what kind of tutoring is offered to them. As far as students using the resources on the campuses, same kind of thing. It's those of us who have foster youth programs at our campuses are doing a lot better with that. If the colleges that haven't had the resources to make that happen, we got ours started with the Walter S. Johnson grant, and also the John Burton Foundation have been very supportive in the technical setup of that and delivering it. So it was private funding that brought that about. There's been some funding recently in the state to support community colleges in doing that, but again, it's going to be student by student, making sure that they reach out. Priority registration is a huge opportunity for us to have that interaction with them. We don't know who our youth are coming in because of privacy laws at this point in time necessarily, unless we're working very closely with our county partners and having activities that allow us to communicate with those students.
Let's stick with you. Real quick question. We do want to get through as many as we can. Is it true that if the Chafee grant is received, it lowers the financial aid amount?
No, and the only thing that would take the place of usually would be student loans, and we want to keep our youth out of those student loans. It could possibly impact their federal work-study opportunities, but the federal work-study funding is not ample to cover all the students that are interested in that program anyway at any campuses. So no, it doesn't take away from their federal Pell Grant. It does not take away from their Cal Grant if they were awarded the Cal Grant. So it's a very good resource, yes.
So one more question for you. Lots of interest in this. Is from a county representative saying they're focusing on soft skills for readying youth to manage college life. I wonder if the colleges have compiled a list of soft skills that we could focus on prior to college to better prepare youth for college success. Any thoughts about that?
Again, college by college, you definitely have representatives on your campuses who are champions for foster youth. So reach out to your campuses, find out if they do have a foster youth program. If not, go to your orientation offices and have a dialogue. It's definitely, I think a lot of it is just youth learning how to ask questions, learning to advocate for themselves. And you know, your colleges would welcome the opportunity to work with the youth prior to them coming to the campuses or even choosing which campus. It may not, they'll work with youth at the high schools in their service areas, whether or not those youth are planning to head to their colleges or not.
Thank you. So the next two, I'm going to combine them, Debbie, are for you. They're on priority registration. Does priority registration apply to all schools in the U.S. or certainly only certain states? And do you have statistics on what % of foster youth, no, let's just stay with that, priority registration in the U.S. or certain states?
So it's just in California, and it's just at the publicly funded institutions, so the community college, CSU, and UC systems.
Great. And do you have, I'm going to stick with you, Debbie, statistics on what % of the foster youth who receive the Chafee successfully complete that year of school? So the kind of, you talked that we talked about persistence rates, but are those for the year that they received it?
So the data that we took was essentially a one academic year's worth of data. So I believe it came from 13-14. So it was for those who received it in 13-14, did they, so I believe you're referring to the retention data, did they complete that year? So I'd have to get, the data comes out of the CalPass Plus system, so I could do a little more research on exactly how it's calculated. But it is for a single academic year's worth of data.
Great, thank you. The next one is kind of a point and a question. The questioner has actually left the web seminar, but I think it's so good I want to share it. What about the concern that once parenting youth exit extended foster care at 21, these funds will end abruptly? Then they'll re-enter poverty due to the lack of post-secondary education, employment, and daycare. And I think it's an extremely fair point. So they get the basic rate, they get a decent infant supplement, and then at 21, CalWORKs, which is really the combined benefit is not even comparable. So I think it's, to me, what that shines a light on more than anything is pregnancy prevention. Let's make sure every child born to a dependent is a child that is wanted. And when we do that, we will see a lot fewer children born. Part of that extremely amazing baseline at age 17 Cal Youth Study is asking how many young people absolutely wanted to become pregnant, like that they essentially wanted to become pregnant. They were pursuing pregnancy. And the figures from that study show that is not typical. It's under 10% of young people wanted to become pregnant. So she's raising a very fair point. We don't have we don't have a solution at age 21 necessarily. The thinking is, let's do what we can while we have a public system that can adequately support these young families, but ultimately, let's reduce the number of young families. All right, let's keep going. Do a few more questions. What are the child care resources available for parenting NMDs? This could be the topic of a whole nother web seminar, but what I will say briefly is that someone who's parenting and who is a non-minor dependent and their child is not detained, so there's no open dependency case on their child. Under the way the California Department of Education has been interpreting its own regulations, that child is not a priority for child care. Now, that being said, some counties are finding ways to get these parenting dependents child care. Other ones are not. And we have young people who are almost at risk of falling out of extended foster care because they can't meet a participation condition. And so the truth is that it's really very localized whether your county is solving this problem or not, but the resources are very limited. All right, just maybe a question or two more, and then we will kind of wrap it up. Here's a comment or kind of a question. Many of the parenting youth I work with are in a housing program called THP Plus Foster Care. Some forward the entire infant supplement to the parenting youth, but others forward only 40%. When a portion of the supplement is held back, a reason that's provided is that there are extra costs. Would AB 1838 address this issue? And what is our current directive around these situations? So this is a very good question. The infant supplement is only paid directly to the youth when they are placed in a SILP. Every other circumstance is paid to the placement. And in this issue specifically for THP Plus Foster Care, Jessica, I don't know if you're still on the line, but could you talk about First Place's approach about how it structures housing for parenting dependents and kind of what the cost implications of that are?
Sure, yeah, I'm still here. From what I understand, the way that it's dealt with is because, like I talked about, the incremental rent costs for our parenting youth are much higher than our non-parenting youth. So the youth who are parenting in our program receive a one-bedroom apartment versus a two-bedroom apartment where you would share with another youth in our program. So the cost of putting a youth who has a child into their own one-bedroom apartment already increases the cost that First Place has to deal with when we are serving this population in particular. So I think right now the majority of the infant supplement, when we use it, has to go toward being able to provide them with that space. And I think from the way we see it is allowing them to have a one-bedroom apartment is essential to the safety of the child, making sure that they have a safe space, that they have room for developmental needs, for bonding with their parent without having a roommate or someone else there. So I think that's where the majority of it is going right now. And so the increase with AB 1838 could provide extra support to help meet these additional needs. And we try to do a lot of other things to support our youth, providing baby clothes, providing like car seats. There's things that we kind of do like collective sharing here to be able to support our youth, our parenting youth in other ways.
And with that could be the requirements. So First Place chooses to do that, and there are probably THP Plus FC providers that don't. And so part of that process of establishing a new rate for group homes at THP Plus FC is what is the dollar amount and what is the expectation that comes with that dollar amount. Right now, that is not in place. It's not required that every provider accommodate a parenting youth like that. So we want to make sure that it's a fair and even playing field. Here's kind of a comment question, and it's interesting. Is there any way to make the increase in the infant supplement available to only those youth in school? We have too many youth just taking advantage of the system, literally having more babies just to get more funding. So that speaks to a lot of different issues around really working with young people, helping them hone their decision-making skills. But it's certainly a point of view, and something that we need to think about to make sure that we're incentivizing the right behavior, the behavior that's going to help with their long-term economic security. This one is for you, Debbie. Is the Chafee voucher available for 1 year or one time only, or each academic year?
So it's available for each academic year up until the student ages out of it, essentially. So it only goes through age 22, so after that point they can't get it anymore. But if they start getting it at, say, age 18, they could get it each year until they reach the maximum age.
Thank you. We have more questions, and I'm sorry we're not able to get to all of them. A lot of interesting kind of issues raised around the parenting of pregnant young people. I think that it is something a lot of people are thinking about, wondering about, and so we hope you will join with us to do that. We'll be following up for everyone who attends with the presentation, the link to the recording, and other materials if you want to get involved by submitting a support letter or participating in one of the upcoming hearings. And we really appreciate your time, and I appreciate all of the presenters today. And definitely Karen Michelizio from Butte College. Thank you so much for being on today's web seminar. And at this point, this concludes our presentation. Thank you and have a good day.